This is a demonstration of administration of medications, oral medications, topical medications, and inhalant medications. This will be the first of two parts. The first part will be preparing the medications, and the second part will be administering the medications. The first thing I will do as I come to my cart is be sure that my hands are clean, because my cart is always considered clean. And then I'm going to prepare my medications. So I am administering medications to Miss Florence Nightingale. So I will find her MAR, and I will pull her medications. And as I'm looking over the MAR, if I see any discrepancy or something that I do not understand or have a question about, I will go back directly to the physician's order. So as I look at this, I will see that for my 8 o'clock oral medications, which I'm administering, and the inhalants, the first one is an optic drop. And because I have a question about that one, as it's transcribed on the MAR, I'm going to the physician's order to check it. The physician's order may be, if it's a computerized system, right there available for me to look at, or I may need to go to the nurse's station to look at the chart. So I happen to have the chart right here for the purposes of our demonstration. So I will find Miss Florence Nightingale's record, and I will check the otic drops, and it would appear demo dose. This is Miss Nightingale. Miss Nightingale, no known allergies, which we always want to check the allergies before we administer the medications. And the optic drops are demo dose optic drops, 1 drop, right eye every day. So this order is correct, so now I'm comfortable with how it has been transcribed. Because I have been with the client's record and at the nurse's station, I will clean my hands again before I come back to the cart. By the way, I would not have had I gone to the nurse's station, I would have locked my cart and put my medications away. So my 15 seconds of sanitizing my hands. And now I'm going to check my medications using a system always. And the system may not always be exactly how we've demonstrated it, but if you do develop a system of your own, be sure that you always use a system. So for the purposes of the CBEA, I would recommend doing it just the way I'm doing it. So I'm going to run my finger down the MAR, and I'm going to come to my first 8 o'clock medications, since those are the ones I'm administering, and the first one is the optic drops. So I will choose the optic drops, and I want to check my medication, the bottle itself, not the box. So I have demo dose optic drops. I'll hold this right next to my medication. Demo dose optic drops, 1 drop, right eye, every day at 8 a.m. for Florence Nightingale. The expiration date on these optic drops is 2020. That would be my first check. I run my finger down again to the next 8 o'clock medication, and this will be Cardi. So I will find Cardi, and I have demo dose Cardi, 120 milligrams by mouth, 3 times per day at 8 o'clock for Florence Nightingale. I come down again systematically to Arrow Inhaler, which is my next medication, and I have demo dose Arrow Inhaler, 1 inhalation, twice daily at 8 a.m. for Florence Nightingale, and the expiration date is 2020. And it appears that my last medication is Digio, demo dose Digio, 0.25 milligrams by mouth every day at 8 a.m. for Florence Nightingale. That's my first check. I'm just going to double check to be sure there's no more pages on this MAR. I'm going to now check them a second time, because we're going to ultimately check these medications 3 times. So that was my first check. And this part of my card appears to So my second check will be systematically again, Demodose optic drops, 1 drop, right eye, every day at 8 a.m. for Florence Nightingale. The expiration date is 2020. My next medication is Cardi, Demodose Cardi, 120 milligrams by mouth, 3 times per day at 8 a.m. for Florence Nightingale. Aero Inhaler, Demodose Aero Inhaler, 1 inhalation, twice daily at 8 a.m. for Florence Nightingale. Expiration date 2020. And Digio, Demodose Digio, 0.25 milligrams by mouth every day at 8 a.m. for Florence Nightingale. So my medications for 8 o'clock are now ready. That checking, did you see, took in the 5 rights of the medication administration. That's what that is about when we do that. So now I will clean my card, or take everything off the top of my card. I don't want to leave anything out. And I will lock my card. Check to be sure it's locked. And now I am ready to go to the patient's room and administer the medications.